Struggling with sleepless nights? Today, we're diving into the best treatments for chronic insomnia that don't involve medication. Stick around to learn how you can improve your sleep and transform your nights. What is the primary treatment for chronic insomnia? Chronic insomnia can be a frustrating and debilitating condition. Many turn to medication, but what if there were effective non-drug alternatives? The best treatments are non-drug therapies like brief behavioral therapy for insomnia, or BBTi, and cognitive behavioral therapy for insomnia, or CBTi. BBTi includes sleep education, bedtime restriction therapy, stimulus control therapy, and relaxation techniques. CBTi adds cognitive restructuring, which means changing negative thoughts about sleep, and has more sessions. Keep watching, as we will guide you through this therapy step by step in the video. If these don't work, short-term use of sleep medicines might be added, but only for a few weeks. Always work with your doctor to find the best plan for you. What is bedtime restriction therapy, and how do I do it? Bedtime restriction therapy helps people with insomnia by reducing the time they spend in bed to increase evening sleepiness and make sleep more solid through the night. Spending too much time awake in bed can cause frustration and alertness, making your bedroom feel like a place to stay awake rather than relax. First, you track your sleep for 1 to 2 weeks using a sleep diary. Then, calculate your average sleep time and limit your time in bed to match this, with a minimum of 5 to 6 hours. Stick to a consistent wake-up time and avoid long daytime naps. This therapy helps break that pattern. It's important to understand how sleep works and what affects it, as this can help you stay committed to the therapy. Gradually, as your sleep improves, you can increase your time in bed by 15 to 30 minutes each week if your sleep efficiency is good. Avoid long naps during the day, and keep any naps short and before 4 p.m. Expect to feel sleepier during the day at first, especially in the late afternoon, but this should improve as you adjust. Remember, it may take 4 to 5 weeks to find the right balance. This method should be used cautiously if you have conditions like epilepsy or are pregnant, and it's best to consult a sleep psychologist for guidance. If you drive for work, be aware of increased daytime sleepiness during the therapy. Stick with it, and over time you should see a steady improvement in your sleep. What is stimulus control therapy, and how do I do it? Stimulus control therapy is a way to help you sleep better by teaching your brain to connect your bed with sleep, especially if you have trouble falling asleep at the start of the night. Wake up at the same time every morning, even if you didn't sleep well the night before, and do this even on weekends. Don't take naps during the day. First, use your bed only for sleep and intimacy, nothing else. Go to bed only when you feel sleepy. If you're not asleep after about 15 minutes, get out of bed. Do something relaxing, then go back to bed when you feel sleepy again. Repeat this as many times as needed. It's okay if it takes a few tries. This 15-minute rule is just a guideline to avoid watching the clock and getting anxious about sleep. At first, you might lose some sleep, but this will help you feel sleepier the next night and fall asleep faster. Remember, this therapy isn't for those who only wake up too early but have no trouble falling asleep. It's important to stick with this routine for 2 to 4 weeks to see lasting improvements in your sleep and feel less tired, less irritable, and more focused during the day. What are the best relaxation techniques to treat chronic insomnia? Relaxation techniques like progressive muscle relaxation, meditation, mindfulness, guided imagery, breathing techniques, and listening to music can significantly improve sleep. It's helpful to practice relaxation techniques during the daytime, not just at night. Start with progressive muscle relaxation. There are many videos on YouTube that teach progressive muscle relaxation, so we won't cover it in this video. If you feel tense while trying to sleep, go into another room and take slow, deep breaths until you feel less tense, repeating this process if necessary. Writing down tasks for the next day can help clear your mind. Reviewing your day backwards can also shift your focus from anxious thoughts. Listening to soft, slow music for 25 to 60 minutes daily can improve sleep quality by reducing anxiety and acting as a distraction from stress. This can be done at bedtime or throughout the day for 3 days to 5 weeks. Consistently practicing these techniques will provide the best results for managing chronic insomnia. How can I cover the entire cognitive restructuring for insomnia course in a few minutes? Let's break it down. The first step is to identify negative sleep thoughts. Here's a list of the top 5 negative sleep thoughts that are common. 1. Believing that you need exactly 8 hours of sleep to function well every day. 2. Thinking that napping or sleeping longer after a poor night's sleep will compensate for lost sleep. 3. Overestimating the impact of insomnia on physical health and daily functioning. 4. Believing you have no control over your ability to sleep. 5. Thinking that sleeping pills are the best or only solution for insomnia. Try to reflect as to what negative sleep thoughts you might be having. Next, keep a thought record, noting when these thoughts occur. Challenge these thoughts by asking if they're based on facts or feelings. Am I jumping to conclusions? Am I catastrophizing or exaggerating the consequences? Learn about sleep science to develop accurate beliefs. Replace negative thoughts with balanced ones, like 7 hours of sleep is associated with good health outcomes, and even with less sleep, I can still manage my day, though I might feel tired. Practice this regularly. Use the Socratic method to question your thoughts deeply and address cognitive distortions. To use the Socratic method to question your thoughts deeply and address cognitive distortions, follow these steps. Identify and write down the negative thought causing distress. Analyze the thought for cognitive distortions like overgeneralization and emotional reasoning. Challenge the thought by asking, what evidence supports or contradicts this thought? Are there alternative interpretations? Am I letting emotions dictate my interpretation? What are the consequences of believing this thought? What would I say to a friend in a similar situation? Develop a more balanced thought based on your answers. Reflect on how your perspective has changed. Practice regularly and monitor your progress. Seek professional support if needed. Separate feelings from facts and focus on sleep-promoting thoughts such as, I can trust my body's natural ability to sleep. Monitor your progress by tracking changes in your thoughts, sleep quality, and daytime functioning. If you struggle with these techniques, seek professional help from a trained CBTi provider. With consistent practice, these steps can significantly improve your sleep quality. If you found these tips helpful, don't forget to like, subscribe, and hit the notification bell so you never miss an update. Share your thoughts and experiences with insomnia in the comments below. Remember, better sleep is possible with the right approach. Thanks for watching and sweet dreams.